Good evening, this is BNN News. I'm Chris Lovett. We begin tonight with hands joined in opposition to the Republican health plan. This morning in the headquarters of Healthcare for All, local advocates gathered with Senator Ed Markey to speak out against the replacement for Obamacare passed last week by the U.S. House of Representatives.
It's a giveaway of the $860 billion that will be cut from Medicaid and packaged as a tax break for the wealthiest in our society. The cruelty, the inhumane nature of taking a program which serves those who are most in need and then taking the money which is saved and handing it over to the wealthiest in our society is just immoral.
And I'm telling you that people with disabilities in Massachusetts and across the nation are scared. We're scared that our civil rights are being denied. We're scared that they're going to take away everything that enables us to participate in society, and that we're going to be going back to the pre-Medicaid times when people with disabilities were either locked in institutions or kept in their homes or dying early deaths unnecessarily, just so that the wealthiest 1% in this nation can thrive.
This debate is about the wealthy getting wealthier and the rest of us paying the price. We cannot allow this assault on our rights to basic health care to move forward. We must speak up and speak out. We will be clear. We are not going to just sit back and die so Congress can make their billion donors happy.
It's not only a blow to people in Massachusetts committed to universal access and universal coverage. This is a blow to the next generation of kids that are going to have a harder time climbing out of poverty without that safety net to protect their health.
These cuts that are proposed, we are really concerned are going to both prevent children who are currently getting served from getting services and or disrupt the care that they're getting by requiring them to see a different provider, both of which can really derail a child's behavioral health and have long-term implications for the course of their entire lives.
It is singularly the worst piece of legislation, healthcare legislation, ever to pass a branch of Congress. Given that we've elected a president who made fun of people with disabilities, who bragged about sexually assaulting women, it's not surprising that this law eliminates protections of pre-existing condition exclusions, decimates Medicaid, and defunds Planned Parenthood.
To help us understand how the Obamacare replacement as it currently stands would affect people in Massachusetts is our guest from Healthcare for All, the Associate Director of Policy and Government Relations, Suzanne Curry. Thank you very much for being with us, Suzanne.
Nice to be here. Thank you.
First of all, talk about how much Massachusetts could be affected by this, because we thought that we had something pretty good before Obamacare, so won't it be as good as it was a few years ago?
I wish we could say that. However, we rely a lot on the federal government for funding to make our program work. It's really a partnership between the federal government and the state government to make sure that we can enroll as many people as possible into our Mass Health program, which is our Medicaid program and our Children's Health Insurance program, as well as through the Health Connector and enable people to get subsidies. So there's a lot at stake here for both the people who are getting help both through Mass Health, but also on the private market and who are getting subsidies.
Talk about the difference between expanded Medicaid and the original Medicaid, which was supposed to cover people who were in poverty or who had certain disabilities or who were elderly and in long-term care. So what else is being cut here?
Right, so the Medicaid expansion enabled adults who did not have children, who were still poor, to get Medicaid. Before, you had to be poor and something else, poor and a parent with kids, poor and disabled, poor and a senior. And the Medicaid expansion really enabled those childless adults who were still poor to get coverage that they may not have been eligible for before. So the new legislation really does take a toll on that population, and it effectively ends the Medicaid expansion as we know it.
Now, in terms of the amount of money in the state budget, there was a figure coming out of Governor Baker's administration. That sounded pretty big, if I recall.
Yeah, they had estimated from the Executive Office of Health and Human Services and the governor's administration anywhere between $1 to $2 billion would be lost in the state budget.
And how would you have to make up for that? I mean, what would have to be, pared down or cut out? Or
Right. So typically there are three ways you can go. You can cut benefits. So you can say, in our mass health program, we're no longer going to cover prescription drugs, or we're no longer going to cover dental coverage for adults. And those are just examples. There could be a lot of other things. We could cut eligibility. We could say, we're carving out this particular population. They'll no longer be eligible. Or you can cut provider rates to hospitals and community health centers and other providers that provide services to people on Medicaid.
This is BNN News, and we're talking with Suzanne Curry from Healthcare for All. Suzanne, I want to ask you about some of the people speaking at the event this morning, because some of them were people with disabilities, pretty serious disabilities, probably requiring a lot of care. And I had the impression from hearing Republicans defending what they passed that people with disabilities would still be protected. Would that necessarily be the case?
We think there's a lot of risk for people with disabilities and people with chronic conditions in particular. One thing to note is that the new funding mechanism that they're developing through this House bill would bring substantially less federal funding into the state for our mass health program, which covers about 280,000 people with disabilities who really rely on some of the services that other insurance companies don't cover, such as long-term services and supports to help keep them in the community. In addition, we've had a great tradition here in Massachusetts of not locking people out of health insurance coverage for pre-existing conditions, but the bill that was passed in the U.S. House allows states to remove protections that are called community rating, which means you can charge people with pre-existing conditions who have a lapse in coverage substantially more, which would push a lot of people out of the market or force them to make some really tough decisions.
Well, when I hear about people with pre-existing conditions, I usually hear about, I guess the scariest stories, people with some sort of serious, maybe almost terminal illness. But I mean, couldn't it also be things that are almost routine, like asthma?
Exactly. There's a whole long list of things that insurers could potentially put on their list, and this is back to the dark days before the Affordable Care Act, where other states in the country, we had a great law back in the 90s that required insurers to cover everyone and not bar people with pre-existing conditions, but that wasn't the case in a lot of these other states. And while the letter of the law still covers people with pre-existing conditions, it does allow the insurance companies to now, first of all, charge them a lot higher of a rate, and then also allow states to remove essential health benefits. So there's 10 categories of essential health benefits that are needed, such as maternity and mental health and substance abuse, that weren't necessarily required of insurers before the Affordable Care Act.
I want to ask you about one area where there has been long but steady progress, in Boston at least, and that's in bringing down the rate of infant mortality, especially among people of color. And I have to wonder, how do you think that might be affected by what's coming down the pike from the Republicans?
I think people of color will be disproportionately impacted by this bill, and there really is not a recognition of how much this is really going to hurt people. I think essentially the bill, we view it as a tax cut for the rich to the expense of the poor and the sick. And we have a lot of work to do with income inequality and racial inequality and inequity and things like low birth weight and infant mortality. And I think this will only get worse as people may get kicked out of their coverage.
What about neighborhood health centers? Because this is not just a place you go to when you feel sick or you've got a chronic problem. Because talk about the things they do, preventative and the outreach.
Yeah, they do a lot of preventive services at community health centers. They're a great resource because they're in the community. They understand the community. They often hire people who are from the community and can speak their language both literally and in the way that people will understand. And they do a lot of outreach work to get people enrolled in coverage, but they also help them connect them to other services that may be important for health, like WIC or SNAP benefits, which are food benefits for mothers and then the general population who are low income. And so they provide a lot of great services.
Now, a number of these health centers, they have expanded, they've rebuilt, and a lot of this was during the Obama administration, and there was some federal help for that. And it was supposed to fit with Obamacare. I mean, now that you've had this expansion, isn't there going to be some kind of financial squeeze? It's going to be pretty rough on a lot of these places.
There could be a financial squeeze for community health centers and particularly for safety net hospitals who may have to eat the cost of covering or providing care to uninsured folks in the state. And I think one of the other things we have to remember is even with this bill, the fight's not over. We have reauthorization of funding for the Children's Health Insurance Program and reauthorization of funding for community health centers that's coming up and will expire at the end of September if Congress doesn't act. So there's a lot up in the air and a lot that could happen, and kind of as a matter of confluence.
Talk a little more about that at Boston Medical Center, because that's the main safety net hospital in Boston. People had worries about it before Obamacare, and yet they seem to deliver. What about going back to, pre-Obamacare, or maybe, whatever the Republicans are devising here? How do you see it for Boston Medical Center in the future?
Well, I think Mass Health and Medicaid is a big driver of the economy in our state, and I think that the reduced funding that is provided in the House Republican bill could have a big impact on the safety net hospitals that we rely on. Less money coming to the state for Mass Health, less money coming into the state for supplemental payments to providers that disproportionately serve people who are low income, uninsured, and on Mass Health. So this could be a big step back for BMC and other safety net hospitals like them.
What about the economy? Because we have this high concentration here of hospitals and health centers.
Yeah.
What do you think is going to happen?
I think it remains to be seen. We're really hopeful that this bill will not make it into the Senate and out of the Senate the same way it's going in. And so we hope that there will be some improvements made to enable us to continue to provide the payments that we're able to make these hospitals, provide that the hospitals can provide the care that they need to provide to their patients, and it still remains to be seen. But that could have a really big impact on people losing their jobs, potentially some hospitals shutting down. And I'm kind of going down the line here. I don't want to say I know what's going to happen, but there could be big ramifications that throughout the system.
I want to ask you about two of the age groups that are being talked about the most here, because this bill seems to divide the younger from the older, and the Republican leaders are saying, this is a great deal. This is pretty good for younger people because their premiums are going to go down, their out-of-pocket payments are going to go down. So, isn't that something?
Well, I think there's a couple of complicating factors here. Okay, so you take out the sicker and older people from, say, the market, and maybe the premiums will get cheaper for folks who are younger. But we have to also remember that the bill also gets rid of the subsidies that had been provided for premiums and the cost-sharing reductions to help with those out-of-pocket costs. So in doing that, you may not have all the help that you need in order to get the coverage that you need. The other thing to mention is there's talk about setting up these high-risk pools. And one of the things that's really harmful about this is they've been inadequately funded, and even the funding that is provided with the Upton Amendment in the U.S. House bill is not going to be enough to make sure that the people with the chronic illnesses and those who are taken out of that market to make it cheaper for the younger, healthier, are going to get the care that they need.
And I think when they had these pools in other states, I guess it was expensive, and sometimes they even had waiting lists, if I'm not mistaken.
Yes, exactly. And so, what do you do if you have asthma and you just need an inhaler to be funded? Because they can be expensive. In order to prevent an attack and from you going into the emergency room, which is the most expensive setting, what do you do in that situation? And I think this is it's really damaging for people.
Well, I know this legislation is going to involve one way or another in the Senate, of course, and you're going to be watching it at Healthcare for All.
Yes,
so if people want to check out your website,
Sure.
You've got some updates they can look at?
Our website is www.hcfama.org, and we're encouraging folks to reach out to their friends and families in other states that have swing senators who may vote one way or another, and make sure they call their senators and let them know how damaging this bill will be for people across the country.
Thank you very much for being with us.
Thank you.
Suzanne Curry from Healthcare for All. Still to come, the opening of a new park on the Neponset River, but first, this message.